Hello and welcome to this episode of Vaccinate India in partnership with Google. This is a program we've been doing every single week, and the basic message here is to remind you, to tell you it's so very important to vaccinate. We are nowhere close as a nation to where we need to be in terms of vaccinating, and unless we vaccinated the numbers that we seek, we aren't being able to protect ourselves, our families, the economy, or I will explain, it's important to vaccinate as adults because we have children now increasingly going to school. In fact, that's something that we are going to be looking at very, very closely on this program. Vaccination for children, it should be starting in the next couple of months, and the entire issue of whether kids should be going to school without vaccination at this stage. What are the pros and the cons? We've got some fantastic minds on that. But let's take a look now at the overall vaccine statistics situation. Remember, this is very easy to access. You just need to go to Google, type coronavirus vaccine statistics. This is what I picked today, and you've got overall numbers over here, and these overall numbers indicate, for example, over here we picked India. You can actually select countries around the world as well. Here is where we are. You can actually click and it will point to where we are. So the 29th or the 30th of July number, as you can see, it's going up, but again we need this to be much higher up. You can also actually pick different countries by going to the right hand side of this map as well. So let's keep going down. Vaccinations by location. Now worldwide, just 14.5% of the world's population has been fully vaccinated, and there is a lot of vaccine disparity, a lot in inequity also. I mean, a lot of these people who have been fully vaccinated are in developing countries. It's not the case really in developing countries where it's a problem. For example, in India, just 7.4% of our population is fully vaccinated. Just 7.4% of our population, as you can see over there, fully vaccinated. Compare that with a developing country like the United States, which has now hit 50%. Germany, which has hit 52.1%. completely vaccinated. So as you can see over there, India really has a lot to catch up on, but then it's also important to note that our population is significantly larger. So let's take a look now at where we stand as far as vaccination is concerned. So 60,15,842 doses given in the last 24 hours. That number might actually sound very impressive, and at one level it is, but it's not close to where we need to be, and that has to do with the availability of the vaccines and actually the administration of the vaccines as well. So if we look at that high which we had on over here in the month of June, actually there was that one day when India really tested our resources and our ability to vaccinate. It actually went down after that. That was directly linked to the availability of vaccines. It's now going up, and that's great that it's going up, and there are a couple of peaks, for example this particular day, a couple of days back, but then the overall trajectory is not shooting up in the way that we want it to go like this. It's still going down and a little up. It's nowhere at the pace that we want it to, and this actually will explain to you what it is that we are trying to stress. This is India's vaccine equation. Why do we need a vaccine equation? Because the more people who are vaccinated, the chances of the third wave, and many say that it's now inevitable that there will be a third wave. The big issue is how strong will it be, when will it come? The more people who are vaccinated, the more people who are safe, the impact would be lower. And the target is 60%. That's what the government and our experts have also been focusing on by and large, that 60% of India needs to be double vaccinated by the end of December. Now, are we actually getting there? Unfortunately, at this stage we aren't, because as of today, the required vaccination rate is 9.6 million vaccines a day. We need to be doing 9.6 million vaccines a day in order for us to get to that 60% mark. Now, actual numbers have been just 4.8 million a day in the last 7 days. So the daily shortfall in the last 7 days also 4.8 million a day. So that's nowhere close to where we need to be. As I mentioned, that's 9.6 million doses a day. So today on the, or in fact on the 31st of July, that's the last set of numbers we have, it was 6 million actual vaccinations that took place. That shortfall was 3.6 million vaccines in order to get to this target of 9.6 million, which is what we have been targeting. So now here are a few more details which I actually wanted to stress as well. Now this is actually from the government, the Ministry of Health and Family Welfare, and they've actually got a great deal of data on their website as well. You can refer to states and districts with the number of vaccines which have actually been administered, but there are also some interesting developments as far as vaccine trends are concerned. Now this is what we really need to be looking at. It's the orange bar, and that orange bar is interesting. It's important because it shows those with 2 doses, and unfortunately it's the lowest of the 3. What we actually need to do is to have that as the highest, because if we have that as the highest, then it shows that the large number of people in India are vaccinated. This is some detail that we don't actually focus on very much. The divide between men and women as far as vaccination is concerned, it needs to be at least 50-50. It's skewed towards men at this juncture. And in terms of the vaccines, and this is all actually a matter of concern, because a large number of vaccines right now are Covishield. That's great that they've been able to up their production. Covaxin much lower, and that target that we've set of 60% vaccination by the end of December is not going to happen unless we see a lot more of Covaxin and a lot more of Sputnik V and many other vaccines. That's not come online in the numbers that we need. Covaxin needs to go up, and all of the other vaccines need to go up as well. And so that's a big problem for us. In terms of the number of people, the pie chart of the age profile of those being vaccinated, you've got 45 to 60 represented by this part of this pie chart. You've got 18 to 44. We have a younger population in this country, so it's good that we are getting those numbers. Obviously those who are older are more vulnerable, and that is those who are above 60. So this is this very important chunk. Remember, they were the first to be vaccinated. So let's now focus a little bit on our discussion for the day, and what we are looking at: children's vaccination, the prospects of children returning to schools in larger numbers. When will we have vaccines for children? Because in so many countries in the world, I should say some countries in the world at this juncture, that started out. Joining us, Dr. Amit Sen, co-founder and director of Children First. He's a child and adolescent psychiatrist, one of the finest in India. Dr. Hemant Thakur joins us as well. He's associated with Jaslok and Beach Candy in Mumbai. Dr. Sanjeev Bagai, the chairman of the Nephron Clinics. Thank you all very much for being with us. Dr. Sen, you know, we talk very much about the mental well-being of adults in this situation. Perhaps we need to be talking a little bit about the mental well-being of children as well. In your experience over the last year and a half, what has been the impact of COVID-19 on children stuck at home?
So the impact has been profound and widespread, I would say, Vishnu. And indeed, there are large-scale statistics, which have also come out from WHO as early as October last year, when they studied youth in different countries and figured that there was a 5-fold increase in symptoms of anxiety, depression, substance misuse, and self-harm. And we see, working with children and young people here, the living examples of that. So we have had a plethora of referrals, and we are overwhelmed by the number of children and adolescents, both very young, starting from the age of probably 4-5 right up to the adolescents, not being able to go out of home, and the infrastructure around them, the daily rhythms that they are so used to, which brings a certain predictability to children's lives, that broke down completely with the first lockdown. And that has created a deep impact on their sense of well-being, their sense of daily rhythms, and they have come up with a range of and multiple physical symptoms like nausea, stomachache, fatigue, not being able to wake up for their online classes, to the older ones, of course, who have felt hemmed in their own homes and not being able to go out and meet their friends, not being able to connect to the spaces of meaning in their lives, whether it is a guitar coaching or a football tournament, just hanging out with their friends in cafes. The choices they had with them has gone missing, and that has brought about a lot of helplessness, hopelessness, and indeed a sense of grief and loss in their lives. So we have seen, even in kids who have not had any, mental health difficulties up to now, coming like in multiples, absolutely. There's been an exponential rise in the symptoms of anxiety, depression, eating disorders, dependence on substances, and scream. And of course, the relational difficulties that they have gone through, being again hemmed in, finding too much of contact with family members. We know for a fact that domestic violence has gone up in across the world, and we have seen the same in India as well. And the impact of that again is traumatic. So they have had to face, of course, besides the fear and the anxiety that comes with the illness itself.
Sure, Dr. Said, lots of really important points, and I'll come back to you in a moment. I wanted to go across to Dr. Thakur. Sir, we talk about COVID vaccine effectiveness. What are you seeing in terms of effectiveness for children in terms of the vaccines which will be introduced? Would it be fair to say that Covaxin, when it comes to kids, would be statistically as effective as adults? We know very little about Zydus E at this stage, biologically at this stage, which is also going to be coming out with the children's vaccine. So, scientifically, how would it work? Would it replicate effectiveness that we see among adults?
So, speculation and science are two different things. We know how Covaxin and Covishield and the others work in adults. We will assume that because the genetic structure of the human being is the same, we should get pretty good results in children. But till we don't get data and results, it's still speculation. However, I want to add a bit of cheer to this. The UNICEF and a lot of pediatric societies all over the world have very clearly shown that about 14 to 15% of all COVID infections in different countries have been in the pediatric age group. And the mortality in such patients, or even bad morbidity, is in the 0.5 and less percentage. So I can only say one thing, that children weather the COVID much better, their morbidity features are much less, their mortality is almost non-existent. That does not mean that we should not vaccinate them. We need to vaccinate them, we should vaccinate them, but we should vaccinate them with that vaccine which produces the best results, as has been scientifically proven, and we are still awaiting the results. A lot of countries are on the threshold of pediatric vaccination, but really there is no diktat as of now, WHO or by pediatric societies. So while there is a sense of urgency, there is no sense of panic. And having said that, I entirely echo my colleague's view that it has caused a lot of developmental issues, physical issues, and a lot of, I don't see so much of pediatrics, but people and children over the age of 13 to 18. There's a lot of developmental issue, a lot of physical manifestation. So getting back to a conglomeration where you have a hybrid kind of structure, because it's been almost 16 months.
No, I know, and that time period is huge. But 1 second, sir, I want to go across to Dr. Bagai. Dr. Bagai, how would you respond to those parents who say that, when you talk about COVID prevention, besides the vaccine, there's the mask, right? And in the context of children who are unvaccinated, it's that mask which is going to save them. How do you expect a child to who's 9, 10, 11 years old to have that mask on for, several hours a day, maybe even if it's not the full school term? It just doesn't happen. Let's face it. It's not going to happen. So should we as parents actually, put our children back into school and potentially, have them fall sick?
I'm on the show.
Hi, Vishnu, and good day to everyone on panel and all the viewers. So let's put certain statistics on the perspective straight away. Children form about 40%, 0 to 18 form 40% of the Indian population, which is anywhere between 40 to 45 crores of the Indian population. The last year's data, which was published, was about 9% of the globe's population tested positive was in the pediatric age group. This year it is 22, which is CDC data. Children are particularly vulnerable because they are largely asymptomatic. 65% of them are asymptomatic. And the children carry the same viral load in terms of viremia, in terms of the RNA load of the virus as adults. They transmit 17 times more. They are also vulnerable because they have a different immunophenotypic profile. Let me explain this in a few seconds. Their B cell response and T cell response is different as compared to adults. There is something called as a B cell switch, which makes the B cells more active or activated. Now, these children who get infected with COVID, largely asymptomatic, ultimately have a decreased immune response, and 13.7% of children land up as long COVID. They have almost 200 symptoms as a manifestation. There are 3 large studies which have been done from Pfizer, Moderna. One is of about 1,300 children, the other is of 2,600 children, and the other crosses almost 26,000 children, which has been published. It's not peer-reviewed as yet, but the vaccine efficacy has been shown to be in the range of 90 to 94%.
Right.
They show a very good, robust antibody response in terms of neutralizing antibody, extremely good T cell response. So T cells are of different types, but the 2 main types are CD4 and CD8. The reason why children haven't been dented very badly with the Delta wave is that the good response of CD8-4 cells are neutralizing against the N-terminal domain, which the Delta variant is affecting. So there is a immunogenic basis why children are a little bit more protected. But I must add 0.1% of the overall load of children get what we call as a disastrous multi-inflammatory, multi-systemic involvement, which involves 29 body organs. And very often the case fatality reaches 80%. Children need vaccination as much as adults. At the moment, it is in the age group being given abroad between 11 and 18. They are now trying it even between the age groups of 6 months up to 5 years, and 5 years to 11 years, 11 years to 18 years. The children must be vaccinated along with the teachers in the school and the staff in the school. We should not be in a hurry to open the schools. We have suffered enough. Children can have disastrous long-term effects being unvaccinated. 92% of all hospital admissions worldwide are in the unvaccinated group. The last thing which we want is children, vulnerable, unvaccinated, long COVID, big disaster.
All right, and thank you for so lucidly putting it. Dr. Sen, one last point to you. Those are obviously the medical concerns. But you know, when we talk about the development of children and we talk about education, people often say that online education is not the same. Obviously, it's not. There is no interaction. But what about the education of social skills, the physical interaction of children? Not just happiness and mental well-being, but the education associated with meeting other children and adults in a different environment. How important is that as an education?
It's absolutely central to the development of children. In fact, there is very robust research even before the COVID times that physical exercise, social interactions produces hormones and chemicals in the brain which actually stimulate brain development. So in a sense, if we are looking at a more prolonged lockdown of schools and social spaces for children, we are perhaps looking at also a stunting of development in the areas that we just talked about, Vishnu, in fine motor skills, in gross motor skills, in social skills, in their ability to actually regulate themselves emotionally. It's a big playground over there outside, whether there are young children or older children, they're constantly practicing these skills. And we have to think closely as to the impact of locking them up over so many months together. What will be the long-term consequences of it, of their development, of their ability to emotionally regulate themselves, of their ability to survive in the real world. And we have to actually consider that before we think. Vaccination is absolutely vital, central. I can't dispute that, and we must make an endeavor. But again, the question is, why have the children been left to the last when the emotional and the developmental consequences are so deep? We have to think about that. We have to think about innovative ways of creating spaces, perhaps a hybrid model of both digital as well as physical spaces, with distancing, with masks, with testing, to be able to get the children back into that space so that they have an opportunity to grow and develop in the way they naturally should.
Sure. Well, I'd like to thank you all for such a fantastic discussion and the science of how the vaccines work on children and what the threats are, and of course the mental well-being of children as well. I dare say we wouldn't have had the luxury of this discussion if India were in the midst of a third wave. Not at all. And one would hope that if schools open, they shut down as fast if the numbers start rising. We're going to take a short break. Up after that, news of a massive corporate donation to ensure free vaccines in private hospitals in Tamil Nadu and the impact that that's going to be having. A million people in Tamil Nadu will get free vaccines at private hospitals before the end of the year. That's what corporates in the state have pledged. Initial vaccine hesitancy has slowed down in Tamil Nadu as part of this vaccination drive and the overall vaccination drive. Now the demand is in fact high. They can administer 8 lakh doses every day, as my colleague Sam Daniel reports.
A million people in Tamil Nadu will get free vaccines at private hospitals before the end of the year. That's what corporates in the state have pledged. Meena got her first dose free at this private hospital moments after she walked in. This is the Tamil Nadu government's new strategy to utilize the 25% vaccines allocated to private hospitals, since so far only around 5% was being used.
First approach is to vaccinate the employees of the company, then the family members of the employees, then the nearby communities. That's the plan what is done. We want to go for a target of to touch 1 lakh doses every day. We have been doing about 30 to 40,000 every day.
In another first, Tamil Nadu has achieved the highest extra doses, inoculating nearly 6 lakh additional people. By using the extra 2 doses in every vial, meant to factor in wastage.
We were able to extract 11 doses consistently. Second is, in the earlier stages when there was vaccine apathy, final vial used to be left unused. So that also we have organized. Similarly, on needle-based, syringe-based wastage also we have reduced.
The vaccine hesitancy initially had slowed down Tamil Nadu's vaccination drive. Now the demand is high. The state can administer 8 lakh doses every day, but it gets only around 2 lakh doses due to short supply. Now the new government adopts what it calls smart ways to tap every avenue available to inoculate maximum population before the likely third wave. In Chennai with Suresh and Annette Beryl, Sam Daniel, Find the TV.
Time now for us to take this short break.